Greetings. Today, I'll be discussing whether stem cell therapy helps regenerate knee cartilage. Knee pain caused by worn down or damaged cartilage is one of the most common joint problems, especially among older adults and people with sports injuries. Because cartilage does not heal well on its own, many patients seek alternatives to surgery, and stem cell therapy has become one of the most discussed options. But does it really help regenerate knee cartilage? If we haven't met already, I'm the digital avatar of Dr. Max McLeod, also known as the Nutrition Ninja Doc, founder of MyBodySymphony.com and the STEM Region/Age Reversal Technology Center, ARTC.Health. He is a problem solver with a focus on helping people overcome their health challenges and achieve their health, performance, and appearance goals. He is using this avatar to save time making videos that can be better spent helping people. My role as his avatar is to convey his knowledge and insights about health, healing, and regeneration. Please note that I'm an avatar of a doctor, and none of the information I convey should be considered medical advice. It is intended for educational and entertainment purposes only. Consult your trusted healthcare provider before making any significant changes to your health regimen. Doc Max also provides individual supervision, in person or virtual. Contact us at 9418-065-511 to learn more. Now let's get back to today's topic. Before that, I ask that you leave a like on this video if you find it helpful. And if you haven't already done so, please hit that subscribe button because it goes a long way to help get these health-related presentations out to more people. Stem cells have the unique ability to develop into different types of cells, including those that make up joint tissues. In knee treatments, doctors often use mesenchymal stem cells, MSCs, taken from bone marrow, fat tissue, or umbilical cords. These cells are injected into the knee joint and ligament attachments with the hope that they will reduce inflammation, slow down or reverse cartilage breakdown, promote tissue repair, cartilage, ligaments, tendons, and/or bone. Improve overall joint function. Research shows promising results. Stem cells can stimulate repair, improve the joint environment, and support the body's natural healing processes. Some studies suggest mild to moderate cartilage thickening after treatment, especially in early-stage osteoarthritis. However, it is important to understand true, full cartilage regeneration is still limited primarily by poor blood supply. Stem cells may help the body repair small areas of damage, but they do not consistently rebuild large or severely worn-out cartilage surfaces. They have been documented to increase cartilage regeneration. Results vary widely depending on age, severity of damage, practitioner's expertise, and type of stem cells used. Many clinical trials are still ongoing, and stem cell therapy is not yet considered a guaranteed cure. So while stem cell therapy can improve symptoms, reduce pain, and enhance mobility, complete cartilage restoration is not yet proven for every patient. Stem cell therapy tends to work better for early-stage osteoarthritis, mild to moderate cartilage damage, younger, active, otherwise healthy individuals. Patients are trying to avoid or delay knee replacement surgery. For people with advanced bone-on-bone arthritis, results are usually less impressive, although we still see significant improvement in terms of pain and function. If you're 70 with really bad knees that you've been told are bone on bone, stem cells can definitely help, but they aren't going to give you a 20-year-old knee. When done properly, they can roll back the degeneration 10 to 15 plus years. Many patients report reduced pain, less stiffness, better mobility, improved quality of life. These improvements may come from reduced inflammation rather than actual cartilage regrowth, although cartilage regrowth has been confirmed in some. Stem cell therapy for knee cartilage has several important limitations. It is not FDA approved for cartilage regeneration as a standard treatment. Stem cells are only approved for certain types of cancer. Everything else is considered off-label. Results vary and cannot be guaranteed. Multiple sessions may be needed. In my experience, multiple sessions are necessary for an optimum outcome. Many stem cell providers inject whatever they are going to use all at once, placing all of the solution in the joint space. It still works pretty well, but I find that splitting the treatment up into 6 sessions works much better. Additionally, the medial and lateral collateral ligament attachment sites should also be treated to help strengthen the entire joint. The cost can be high and is not covered by insurance. A typical cost ranges from $6,000 to $9,000. The main variable is how much regenerative solution is used, stem cells and/or exosomes. Studies show that stem cell injections are generally quite safe when performed by trained specialists. As with any new treatment, many providers are not highly trained in giving injections. Risks may include temporary pain or swelling infection, no improvement in symptoms, extremely rare immune or tissue reactions. Stem cell therapy may help the knee heal, reduce pain, and improve function, especially in the early stages of cartilage damage. True, complete cartilage regeneration remains limited, and more long-term scientific evidence is needed. For now, stem cell therapy is a potential primary and supportive treatment. No one can guarantee results with stem cell therapy or any other treatment, including knee replacement. Interestingly, about 25% of our knee patients have had knee replacement on one knee and simply don't want to go through that with the other one. That's exactly why we created the coaching program at Age Reversal Technology Center. If you're ready to stop guessing and actually get the results you've been reading about, call or text us right now at 941-806-5511. Your first 10-minute phone consult is completely free, no pressure, no sales pitch. We'll just tell you straight. Age Reversal Technology Center, 941-806-5511, 6968. Professional Parkway, Lakewood Ranch, Florida. Nationwide telehealth available. One phone call can change the next 10 years of your life. Make it today.